Hi, my name is Zua Yang.
And my name is Stacy Karkanen.
We know that cost is a barrier for seniors. Evidence shows that access to consistent medication adherence decreases hospitalizations, nursing home, and rehab stays.
Assembly Bill 211 runs on budget neutrality, offering low-income seniors access to prescription medications and allows an appropriation for program expansion affecting your district. Let's show you why you need to support Assembly Bill 211.
The bill was introduced in May 2015 by Democratic representatives and senators. It failed to pass on April 13, 2016. Senior Care Program was approved in 2002 by the Centers for Medicare and Medicaid Services. The program offers comprehensive prescription drug benefit to Wisconsin residents who are age 65 years and older with low income. The program in 2012 offered medical therapy management to help seniors with making sure that they are on the medications that are working for them. Prior to 2006, senior care was the only pharmacy benefit available to low-income seniors in Wisconsin. And since 2006, senior care has served as a credible alternative coverage and wraparound for Medicare Part D. In 2011 and also in 2015, Governor Scott Walker proposed to cut senior care by $15 million. His proposal meant that seniors had to get Medicare Part D coverage first before they could apply for senior care, and senior care would only cover medications not covered under Medicare Part D. The purpose of the bill was to provide help to Wisconsin seniors with enrollment fee and the cost of prescription drugs under the senior care program. The monies to administer the program come from two places: the state's general purpose revenue, or from program revenue. The bill requires that any general purpose revenue remaining after paying pharmacies and pharmacists be developed into an appropriation to reduce enrollment costs and copays, and also to enlarge medications on the formulary. So we can't talk about this bill without knowing who is going to be affected if this bill does not pass. And what stands out is that the income is at $25,000 or less for 33.1% of this population. And people age 65 or older make up 14.8% of Wisconsin's population. As you can see, the majority are female. Most of them are married, and about 29.3% live alone. The majority of the ones that live alone are female. The education level is at 43.1%, having a education above a high school diploma, and about 15.3% are still employed. I also want to add that at the income level of $25,000 or less, this qualifies a senior to fall into level 1 in the senior care program, which is the lowest cost to seniors.
So our stakeholders for Assembly Bill 211, first would be the Wisconsin Department of Health. The Wisconsin Department of Health oversees many different programs in Wisconsin, including programs for our seniors. So they oversee and help out with the senior care program. The Centers for Medicaid Services also manages the senior care program and how it is run in helping to manage where the monies are going. So they have a big stakeholder portion in our senior care program. Now, our pharmacies and our pharmacists also have a stake in the senior care program. They are called upon to have the medications available and to use the medications that are in the formulary or what has been approved to be in the formulary. Our pharmacists do the medication therapy management for our seniors to ensure that they are on the appropriate medications for the diagnoses that they have, and to ensure that they're not over medicated or that their medications don't have contraindications between them if they are seeing doctors in different specialties or even in different clinics. Now, our tribal health directors are very involved in senior care and the decisions that are made for seniors in the state of Wisconsin. There are many Native American tribes in the state of Wisconsin, and with our aging population, our Native Americans are also aging, and they get their health care through their tribal healthcare centers. So their directors, their tribal health directors, are very involved and are very knowledgeable about what is available to the seniors, and they also have want to know and have the ability to help to determine and to agree with or disagree with different ideas and different bills that are passed. Wisconsin Department of Health and the Centers for Medicaid Management also include our tribal health directors in many of the decisions that are being made. So many times when we think of unintended consequences, we think of something that is negative. In the situation with our senior care program, our unintended consequences actually very positive. What happened is that we had high enrollment numbers and increased compliance with prescription medications that resulted in larger than expected decreases in hospital and nursing home admissions, which resulted in a very large cost savings. And that cost savings is what I was talking about in the last slide that allowed senior care to achieve budget neutrality and continue to operate as a very positive program. The other unintended consequence was the increased need of pharmacists to complete the medication therapy management for our enrollees. Again, as I had mentioned in the last slide, our population is aging, so with the aging population, there is more need for medication therapy management, which means that there's more need for pharmacists, and actually more need for pharmacies to be a part of the senior care program. Even though we have great positive results with our senior care program, there is a research out there by Castleham, Hybrids, Cowdery, Filchino, and Asaman from 2015 that inform that they found no relationship between drug coverage and self-reported measures of general health status and functional disability. It's important to realize, though, that this report is a self-reported measure from the seniors themselves. It doesn't really have a great way to measure the actual health status and functional disability of our seniors. You can see from the other unintended consequences with the high enrollment numbers and the high cost savings that other evidence does not support the study from the self-reported measures from Castleham, Hybrids, Cowdery, Filchino, and Isaman. So because Assembly Bill 211 failed in the 2015 Senate, there isn't a fiscal estimate available. However, the Wisconsin Department of Health's senior care renewal application informs that senior care continues to achieve budget neutrality and has done so since the first waiver was granted in 2002. That's a pretty big hurdle to achieve and a pretty positive thing for the senior care program. So we recommend approval for Assembly Bill 211. Assembly Bill 211 calls for an excess of funds and using an appropriation to put those excess funds in so that we can decrease co-pays for our seniors to continue to get their prescription medications. It will also increase the number of medications available on the formulary and the prescription drug availability on the formulary. This can continue to increase the health of our seniors, keeping them out of hospitals, out of nursing homes, out of rehab facilities, and having a cost savings to continue to fund the senior care program.